Although the United States is a well-developed nation, maternal, infant, and child health is a big issue that public health specialists continue to face. BreastfeedLA is a nonprofit organization that addresses the topic of maternal, infant, and child health. More specifically, infant care objective number 21 to increase the proportion of infants who are breastfed. According to the World Health Organization, breastfeeding is exclusively encouraged for infants for at least the first 6 months of life. Breastfeeding has benefits for both mother and baby, including reducing risk of breast and ovarian cancer in mothers and reducing the risk of developing childhood illnesses and obesity later in life for children, as well as immediately boosting the immune systems of both the mother and baby. BreastfeedLA targets women in Los Angeles, California who are pregnant or new mothers in hopes to encourage breastfeeding and also educate public health workers on the benefits of breastfeeding. BreastfeedLA is funded through its sponsors, donations, fundraising, and other events, and markets to Los Angeles residents through their weekly newsletters, social media accounts, and most importantly through its volunteer advocates. BreastfeedLA relies heavily on its volunteers to be advocates for breastfeeding and become familiar with legislation and issues surrounding maternal, infant, and child health. Formed in 1994, BreastfeedLA was previously known as the Breastfeeding Task Force of Greater Los Angeles. The group, started by volunteers motivated to improve the rates of breastfeeding among mothers in LA County, officially became a nonprofit organization in September of the year 2001. BreastfeedLA is on a mission to improve the health and well-being of infants and families through education, outreach, and advocacy to promote and support breastfeeding, and pride themselves in diversity, inclusion, and equity to facilitate their mission of commitment to protecting, promoting, and supporting breastfeeding in the communities they serve. Programs and services offered by this community-based organization include webinars and in-person seminars with lactation experts and other community health workers to raise awareness and approach common issues mothers often face surrounding breastfeeding and infant care. The organization also provides programs to educate community health specialists on how to be effective educators on maternal, infant, and child care. The most prominent program implemented by BreastfeedLA is their Lactation Education Specialist program. The goal of this program is to equip health educators with the ability to provide resources and information surrounding maternal and infant care that effectively reaches the diverse population of Los Angeles. The program also works to identify the barriers and disparities found in the healthcare system that impact mothers and infants. BreastfeedLA provides education courses targeted towards health education specialists hoping to become lactation consultants, gearing them with basic breastfeeding management knowledge, such as basic anatomy of physiology of lactation, positioning and latch, common breastfeeding challenges, counseling skills, early postpartum management, alternative feeding methods, how to create a prenatal breastfeeding class, local and global public health considerations, and more. This program allows its attendees to become certified lactation educator specialists, which is valid for 5 years and can be renewed annually thereafter. In order to work with this health program, individuals must be able to understand the barriers and disparities that women and mothers face that cause the low rates of breastfeeding in Los Angeles. An ability to work with a highly diverse population is also necessary. This includes various cultures, age groups, and family dynamics. Los Angeles is made up of many minority groups, including the largest Asian American population in the entire country. BreastfeedLA has worked to improve the breastfeeding rates among their Asian American population by creating a website with resources in different Asian languages. BreastfeedLA also encourages and promotes Asian health professionals and community health workers to become advocates of breastfeeding in order to promote cultural competence. Today, the organization has a staff of 7 dedicated individuals to work and run BreastfeedLA and carry out their vision, including an executive director, program manager, and education coordinator. BreastfeedLA has an office in Hawthorne, California, and a phone number and fax. They also manage a Facebook, Twitter, YouTube channel, and Instagram, all to expand their outreach and continue their advocacy for the women and mothers of LA. For more information on their goals and objectives, visit their website at www.breastfeedla.org.